Hello, hello. Welcome. If it looks like I'm basically like crawling into my mic, it's because it just seems so quiet. Even if I'm just like here. So I'm trying to like see if this is going to make a difference. Hopefully. We'll see how it goes. If you are joining live, say hi. And same with if you're catching this on replay, you can always let us know your comments, say hi. You can just put a little hashtag replay in the comments to let us know that you're watching this on replay. Okay, so today we're talking about the topic of difficult patients. And I'd love to know from you guys, what comes to mind when you think about difficult patients? Who do you think of? Who comes to mind? Sometimes these are like very specific patients, and sometimes we may have had like an interaction or some kind of situation, let's say, happening with a patient. And then it might be more specific patients. But I do find that clinicians often have a kind of a type or a kind of patient or a type of patient or some sort of pattern in the type of patient that they tend to see as difficult patients. And that might be different from one clinician to another. So it's also nice to see who one clinician thinks of as a difficult patient versus another. I found that there are similarities, like there are common ones that clinicians tend to struggle with, but also sometimes surprising differences. So I really encourage you guys to share what kind of patients you see as difficult. Like, is it a patient that does a specific thing? Is it like a personality type? Is it like something that in terms of like their body or the like certain conditions you don't like seeing or whatever it is, right? Let us know in the comments. I'd love to know. And you can also let us know how this affects you. So how does it affect you when you have patients on your schedule that you see as difficult patients? Whether that's like on the day seeing your seeing your schedule. Just wanted to add something here. Whether that's on your schedule, like you see those patients on your schedule and your heart just kind of sinks, like you dread it, or you feel almost like preemptively drained by that. And then more like bigger picture, right? Like does it affect your happiness in your career? Does it affect your fulfillment in your career? Does it affect your health, right? Because you're more stressed when you see those patients. Or you feel like you have to physically give so much more, you have to work so much harder, and so it's affecting your physical health. Let us know if you're watching live. So we're just answering these two questions. One, what kinds of patients do you tend to see as difficult? What are like the trends, the patterns? And then how does it affect you on the day? And then also in general, how does it affect your fulfillment, your happiness, all of that, your desire to be in your career? Okay, so I will give some examples of the types of patients that I've found clinicians see as difficult. And you can let me know if any of these resonate with you, if any of these you also feel, okay, yeah, these are my difficult patients. So sometimes it's patients that are ungrateful. So they either like, they just don't express gratitude, or it's kind of like, it just feels like it's never enough. They're always complaining about things. They're always finding something wrong with it. Even when they make progress, to them it's not big enough, it's not good enough. So some form of like being ungrateful. Patients that are demanding or dominating. This was quite a strong one for me. Like if a patient was quite like a strong personality, a strong dominating presence, I struggle with that a lot because I'm more kind of quiet and reserved, and so that was the type of patient that I struggled with. Patients that didn't listen. And I don't mean like, this is also one of the categories that I put down, like not listening to what you tell them to do. Like they're not taking your advice. They're not doing, for example, exercises at home or making the lifestyle changes or tracking their headaches like you asked them to, or whatever the case is, like something that they were supposed to do that you gave them advice on and they didn't follow that advice. But there's also the listening of just like, I'm speaking and you don't look like you're listening. You're like, I can see you mentally going somewhere else. You're either bored or you're just like, not bothering to listen to what I'm saying, or like whatever it is. Like that was really frustrating for me. So not listening in both meanings of the word. People who are, this is specifically in a profession where you maybe have to, like I was saying, work physically harder, or like do more, or you perceive that you need to do more. When a patient is like in chiropractic or maybe physiotherapy, for example, if a patient is just very stiff, they're not very active, they're not very flexible, they're not, like you have to work harder, or they are very unhealthy, so they don't do anything, or you perceive that they don't do anything for their own health. They are eating unhealthy, they aren't exercising, they, doing all that kind of stuff. They're very unhealthy. They're very kind of far from where you want them to be. Like if they were healthier, if they were less stiff, whatever, they would be able to get better so much quicker. Patients who don't do, that was one that I mentioned earlier. Patients who have, this is also a common one, like people will put it as like don't take responsibility for their health, or they have like, or just their life, and they have kind of like a victim mindset, like everything is everyone else's fault. They're blaming everybody else. They're making like quote unquote excuses for why they couldn't do XYZ, and not taking responsibility onto themselves. People who are like, they make inappropriate comments, they make racist comments, sexist comments, they make fun of your career, or they don't seem to respect what you do or who you are, those kinds of patients. And then the last one is sort of that category of they're sort of, I don't know what you'd put that, but like kind of your systems and procedures and stuff like that, but they cancel last minute, or they cancel repeatedly, or they don't show, or they don't pay, or they don't pay on time, or whatever it is. They try and phone you at like midnight, or whatever, those kinds of difficult patients. So those are the kind of the things that I see, that clinicians see as difficult patients, myself or other clinicians. And you're welcome to add in the comments your own. It's good to know also if there are things on this list that I don't have, and then we can make sure to address that as well. And then also like with part of the, I was just thinking now, the like being stiffer or like unhealthy or that kind of thing, you can also maybe have like people who have very complex conditions, like, or they have multiple conditions. They have so many things wrong with them, that it's very difficult to either know what's actually going on, or just because you now have to like treat all these different things, right? So complex, clinically complex. And then, yeah, so, sorry, those are all the like examples, the different types of difficult patients. And here's what I want you to think about, and just have this idea like mulling around in your mind. What if there was no such thing as a difficult patient? what if there is no such thing as a difficult patient? And what I mean by that is, what if there were no patients that that make you feel drained, that create a certain like horrible emotional state in you that stays for a long time, that affects your day, right? Like one patient ruining your whole day because you're so like drained by them, or you dread seeing them. What if there were no patients that could negatively affect how fulfilled and happy you are in your career, or how stressed you are, how healthy you are, all of that? So in that sense, what if there were no difficult patients? I think this is such a cool idea. And such a like shift in how we think, right? Like, what if there was no such thing as a difficult patient? Say hi if you're joining live. And I just want you to think about that for a second. What if there was no type of patient that could make you feel unfulfilled, drained, dreading work, stressed all the time, no one that could ruin your day? What if that was the case? So here's what I'd like you to think about. What if every patient that we experience as difficult was just showing us where growth is needed? And I'll give you some examples of this, right? So in other words, it's like, what if they're just giving you information on where something needs to change, where you need to grow, where you need to do something differently or think about something differently? So for example, what if it was a patient was just giving you information on where you need better boundaries, where you need better systems and procedures, or you have to enforce those better, right? Like when a patient doesn't show up, or they don't pay, or they ask for discounts, or they want last minute changes, or they demand something of you in your treatment, or they make inappropriate comments. It's just showing you, oh, where do I not have strong boundaries? Where am I not enforcing my policies? Where am I not very sure about what I'm doing and what I'm offering? So that when a patient demands something of me, I don't just give it to them, right? Like someone can demand that I change my treatment in some way. But if I'm very sure of, this is why I do the treatment this way, this is what I believe, this is my philosophy, this is how I do things at my practice, it's not going to bother you if someone demands something else. And you're like, yeah, I get that you may want something else, and you are either welcome to stay here, and I am more than happy to explain to you why I do things this way and why I think it's important to do things this way. But you're also welcome to go to another provider if that's not what you want. What if it gives you information on where, like we were talking about the clinically complex person, right? Maybe it's showing you where your clinical skills need some growth, some work, some development, right? Like what if it wasn't a bad thing that someone, that you can't figure out what's going on, or that they have all these things going on? Like what if that's just a challenge to you clinically, and you get to go like, oh, this is great, I get to grow from this, I get to learn so much from this. And the only reason we see that as not that is because we make it mean something about ourselves, about us as a clinician, when we don't know what's happening, right? Or when we don't look smart, or we don't look like we know everything or can do everything. When we have certain insecurities about that, that's when we get worried about that kind of thing, right? Like if a patient really is showing you an area that you don't know something in, that is a stimulus to go and learn more about that, or refer them to someone who does know more about that, right? It doesn't always have to be you that you have to know or have to learn about everything. It can sometimes be like, oh, actually, this is not in my wheelhouse, I'm going to refer this person on. Maybe it's showing you areas where you have insecurities. Maybe it's showing you areas where you're asking a patient to provide you with something that is not their job to provide you with. So they don't have to validate you. They don't have to be grateful for you. They don't have to respect you or appreciate you or none of that stuff, right? That is not their job. So often we have insecurities. We're like, oh, I don't know if I'm a good provider. So I need my patient to appreciate me and to validate that I am good at what I do. I need you to get better because I need to feel good about myself as a healthcare professional, right? So often it's showing us where we have insecurities or where we're looking for a patient to provide us with something that is not their job to provide. So, and that can also show you like where you need a stronger sense of self, where you need to be sure about what you believe, what your philosophies are. You need to be sure and confident in who you are as a healthcare professional. That you know you're a good provider, regardless of what your patient says, because one patient will tell you amazing, that the next patient will tell you terrible, and you need to know what to believe about yourself, and that comes from you. This is another interesting thing is we get very frustrated when patients have that kind of victim mindset, when they are blaming and they don't take responsibility for their health and all of that, right? But often we end up being a victim to that patient. Think about it. If they are the reason or patients like them are the reason that you are not happy in your career, you are now a victim to them. So it's just something interesting to think about, like always kind of turning it around and just seeing like, where am I doing the same thing that I am frustrated with in terms of my patient's behavior? Where is the difficult patient showing you where you need better leadership skills? Where are you maybe not leading them very well? Where are you maybe not leading in terms of, this is my practice, this is how I run things, I'm a leader in that sense, and being strong in that and being secure and committed in that. Learning how to influence and coach people through behavior change, right? Like when we are so frustrated that a patient doesn't do their exercises, where is that showing us that we maybe need more skills when it comes to helping people make changes? Or it might be showing you that, you know, if a patient genuinely doesn't want to make a change, I used to have these patients as well. Like I would be so excited about like helping them be healthier and like move more and eat healthier. And I was like, I don't want you to be dependent on me. So I want to like, you know, we just do a few treatments and then I show you like ways that you can manage your pain at home and ways that you can be healthier so that you don't have as much pain and all this kind of stuff. And like, some patients loved that and they ran with it and they did it. Other patients were also loved that, but they were struggling to actually make the change. So those would be the patients where I would be helping them make the change more. And then there were some patients who were not interested. They did not care about my explanations. They did not want to know how to do this at home. They were like, I would much rather just come to you, pay you, you treat me, and I go home. Right? So sometimes patients are just not interested. And that's okay. That's their choice. They need to have autonomy, right? We can't be like, no, I need you to do these exercises because I need you to get better, because otherwise I don't feel very good about myself as a healthcare professional, right? Where are you needing that from the patient? And none of this is a bad thing. Like, I don't want to shame you for needing these things from our patients, like validation and acceptance and approval and all of that stuff. That is like a very human thing to want, right? We just have to notice where we're getting into people are difficult or patients are difficult. It's like an external thing versus looking to like, oh, where am I maybe needing that from them, when actually that is for myself to provide. And then the last one is, what if it's just showing you where you need to be better able to connect to someone who is further away from where you want them to be? So think about this for a second. If a patient is very unhealthy, if they are like stiff, they are inactive, they are like everything, you know, all the things that we think of as like, oh my gosh, this patient is going to be so much work, right? All of those things are just that. It just means that there's a much bigger gap between where we would want them to be, which is like pain-free, healthy, mobile, all of that kind of stuff, and where they are. And we need to get better at meeting patients exactly where they are and helping them take the next step forward. Like maybe that patient just needs you more. Like I think about this often because, again, as you know, this is different for each profession, but something like chiro and physio, again, like we want patients who are more active, who are healthier, who take responsibility for their health, all of these things, right? Like we want more of those patients. We don't want the patients who are unhealthy, who are like inactive, they're so stiff and immobile and all of these kinds of things, right? But think about which of those types of patients need you more. Which of those types of patients need a healthcare professional more? So often we are wanting that because it makes us feel better as a healthcare professional. It's easier on us, right? And I'm just saying it doesn't have to be easy on us. We can also find joy and fulfillment in helping people who really need our help, who really are like at the beginning phases of that. Those people need us as well, and probably need us even more. And this is something like, for example, with a chiropractor, like when we do an adjustment, and it's much easier to kind of like loosen up a patient who's already kind of mobile and is active and is generally healthy. Like it's easier to loosen them up or however you want to say it. I'm just using terminology that like non-chiropractors will also understand. It's easier to loosen those patients up, right? So you feel better about your job. It's like it cavitates, it moves easily, it like, you know, your job just feels easier. And then the patients who are like really stiff and in a lot of pain, or just very inactive, or all that kind of stuff, right? They actually need that more, but it's less easy for us. It's more stiff. It doesn't loosen up so easily, so it doesn't have this like satisfying like feeling of like your treatment, right? Your treatment feels less satisfying. And this is, I think, also like where we need to keep coming back to what they call like first principles, like keep coming back to what really matters. And usually if you think about that, if you reorientate, never get that right, back to like what is most important, the most important thing is that you help your patient to the best of your abilities. You help someone as much as you can. So if that's the only goal, it doesn't matter where they're starting. It doesn't matter how easy it is to do that treatment, right? It doesn't matter how grateful they are or respectful or like, you know, how much they sing your praises and all of that, right? So if you can keep reminding yourself to come back to that. And I will also say, I think sometimes people take it to the opposite extreme where they think that helping patients more means just giving and giving and giving. But I think it's really important for us to think about, if I am giving to the point that I am exhausted, I am developing physical complaints, I am resentful, I'm like, I give so much, right? There's a point that stops being in service of your patient. There's a point that stops being helpful, especially if you're looking at the longer term. Like if you reorientate to your longer term goal is to help as many patients over your career as possible, or to help them as deeply as you can, or help them in a meaningful way, you will change the way that you practice and the way that you look at these things. And then you won't only need patients who make you feel good about yourself and who make you feel smart and make you feel listened to and appreciated. And again, those patients are amazing to have. I just don't want the opposite to have such a huge effect on your career that you are putting your fulfillment and health in the hands of other people. You're giving them that control. And I talk about this a lot. Like when I say taking responsibility, when I say it's just giving you information on where you need to grow and develop, this is not about blaming yourself. It's not about, oh, patients can just do whatever and you just have to sit back and let them do whatever, right? In fact, it's the opposite, because you are now able to more be in the driver's seat. For example, in the category of, maybe it shows you where you need to be more stronger with your boundaries, clearer about your policies, right? That's not being like, oh, patients can just do whatever. It's just about looking at, like, where can you control things? What can you control? You can control your own self-development. You can control your own emotional regulation. You can control your own perspective of, like, how can I take this difficult situation, difficult patient, and use that as information? How can I use that to make me a better clinician for the next person? So it's just taking back that that agency, that autonomy for yourself, and not putting your health and fulfillment in other people's hands. Okay, I think that was it that I wanted to say. I'd love to know your comments, your thoughts, and how this kind of shifts for you when you start thinking about, like, what if there are no difficult patients? And what would be different about my entire career if I stopped seeing certain patients as difficult? If I stopped having that, like, dread and feeling drained by certain patients? Like, what if I even was excited to see that patient that is, like, challenging and difficult for me, because I was like, ooh, an opportunity to grow. And that might feel far for you, but I want you to try that on. Just try on that thought. And this is something that I've mentioned before. I can't remember in what live. By the way, there's also related a similar live to this one if you want to go and look at that. It was the one on navigating negative comments or opinions. I think I called it dealing with crappy comments or something like that. But yeah, sort of similar things, and that encompasses also, like, comments from colleagues or other healthcare professionals or patients, etc. Where was I going with that? Oh, in the story. So one of my friends, when she was waitressing, she would get a lot of, like, difficult clients. No, it's not clients, customers. And if you've ever waitressed or waited, you know the kinds of people. But she would have a lot of very difficult, very demanding, saying, horrible things, basically seeing her as, like, she's just a waitress. So they were very disrespectful. They would make inappropriate comments, whatever. And she just had this thing of being who she was and being happy and optimistic, because that's, her natural, authentic self. She was just going to be that no matter what. And so she said she would, like, pretend that she didn't know that someone was being rude to her. She would just, like, carry on as if they didn't say anything mean. She would just, like, carry on being herself, and almost like, yes, I'm so dumb, I don't even, like, know that you're being rude to me. And sometimes people would come around, right? Like, if after a while you're trying to be mean to this person and they're just themselves and they don't seem to be affected by it at all, eventually you just, like, stop that attempt, right? So sometimes it can genuinely influence your patient's behavior, right? Or other people's behavior, right? Like, if you talk about why it's so important to be active, what is so amazing about being healthy, like, what does it feel like, right? Almost like making that really desirable, instead of like, well, you should care about that and you should be healthy. Right? People do things more out of desire than they do out of like obligation, or like a sense of, yeah, should or have to, or so just remembering that and making sure that you are leading that, you are influencing them with your own values, with your own ideas, and with your own sense of self, right? So sometimes you will actually, through being yourself and being like unaffected by people's negative thoughts and comments and behavior and all of that. But other times, this is what I want to say, is like, that's not the reason we're doing it necessarily, right? We're not, I'm going to be this way even though my patient is being that way. I'm not going to do that in the hope that they might change, right? In the hope that they might become a different person. It's like, even if they never change, I just don't want to be experiencing my career in this way. So I'm going to behave the way that I want to behave. I'm going to have a very strong sense of self. I'm going to be very sure in my convictions, in my commitments, in what I believe, in my clinical skills. I'm going to keep growing. I'm going to keep being better at helping patients in different ways. And if that ends up in someone else being different or changing their behavior, cool. But that is like more a side effect, right? I'm doing it because that's who I am. I'm doing it because that's the clinician that I am, regardless of whether a patient is easy or difficult. I'm the same clinician. So that's the kind of idea that we want to start embodying. I hope that was helpful. And again, let me know your comments, your thoughts, and I will see you guys next week. Bye.